Hello guys, welcome to Basic Nursing Classes. Myself Amanpreet. In today's video, we are going to discuss the difference between diabetes insipidus and SIADH. Okay, that is syndrome of inappropriate antidiuretic hormone. These both disorders, these are related to inappropriate secretion of ADH, and these both are opposite to each other. So it is better to discuss both diseases by comparing them. It's easy way to remember both the disorders. Okay, so let's move on. First of all, we should normally know what is the pathophysiology behind the function of ADH. Okay, ADH, it is basically secreted by hypothalamus, okay, in the brain. Then it is stored in the posterior lobe of pituitary gland, okay, and then depending upon how much water the body needs, it is secreted by the posterior lobe of pituitary, and it affects the kidneys, and in kidneys it affects the renal tubules, and in renal tubules it is responsible for absorption of sodium and water depending upon how much water the body needs. Okay, so that's the basic function of ADH in our body. Now what happens in diabetes insipidus? In diabetes insipidus there is suppression of ADH, that means insufficient production. Insufficient production means it is too less production of ADH than the required level. Okay, the body needs ADH but it is producing very low amount. Okay, which leads to some sign and symptoms like excessive production of urine, because the body, it is not absorbing water. The amount of water the body needs to absorb, it is not absorbing, so extra water is secreted through the out of the body. Okay, but in SIADH it's exactly opposite to diabetes insipidus. There is increased production of ADH, too much production than the required level. So what happens there? The body absorbs water which is more than required level, so water intoxication happens. So increased water reabsorption in the renal tubules happens, which leads to water intoxication. Okay, so that's the basic difference between diabetes insipidus and SIADH. Now let's move on to the causes. Okay, firstly, if we discuss about diabetes insipidus, the main cause, it can be any damage to hypothalamus or pituitary. For example, if we are manipulating the pituitary gland or hypothalamus, like in surgical conditions, okay, or any tumor in hypothalamus or pituitary, or any injury to both glands. Okay, other cause can be any damage to the kidneys. The kidney is not receptive to ADH. The pituitary gland is secreting ADH, but the kidney is not receptive. Okay, the kidney is not receptive, so it is not absorbing the water which the body needs. Okay, so it can lead to diabetes insipidus. Other cause, like if the patient is pregnant, then the placenta, it has the ability to produce vasopressin, and that vasopressin, it can break down the body ADH. If the body ADH, it is breaking down, so the kidneys are not able to absorb water. Okay, so that can lead to diabetes insipidus or any infection in the central nervous system. Okay, so these are the basic causes in diabetes insipidus. Now let's move on to some causes which can lead to SIADH. So first cause is obviously any damage to hypothalamus. Okay, the hypothalamus is producing too much of ADH. The, for example, any tumor inside the hypothalamus. So the tumor cells, they are producing too much of ADH. Okay, or some cancer cells inside the body, and especially the lung cancer. The lung cancer cells, they have the ability to secrete and produce ADH. Okay, So what happens in lung cancer, the body is already producing, the pituitary gland is already secreting the normal ADH level, but in addition the lung cancer cells, they are also producing ADH. So that leads to extra secretion of ADH, overproduction, okay, which can lead to water intoxication. Other example can be any neurosurgery, any neurosurgical condition. So in that condition, there can be impaired production of ADH, okay, or if the patient is on desmopressin. Desmopressin is another name for uh, vasopressin, which is artificial, okay. Desmopressin is artificial vasopressin if the patient is on the medication, okay. So if the patient is externally taking the desmopressin medication, so that can also lead to increased production of ADH, okay. Extra amount is producing, okay. So that's another cause. Next is any trauma of the central nervous system, okay, or any infection in brain or lungs, for example pneumonia or meningitis. And in these conditions also the body is producing too much of ADH, okay. So let's move on to the sign and symptoms. Firstly, if we discuss about diabetes insipidus, okay, from the name itself, because it is diabetes, what happens in diabetes, there are 3 P's, okay, polyuria, polydipsia and polyphagia, okay. And in diabetes insipidus, because there is less production of ADH, the kidneys are not absorbing the water and the extra water is secreted throughout the body, so it can lead to polyuria, okay, increased urinary output. It's the first symptom, okay. And the output can be from 4 liters to 24 liters per day, okay. And if the body is secreting the water, so it can lead to water craving, that is polydipsia, okay. And if the body is producing too much of urine, and that will be diluted, it will not be concentrated, and the specific gravity of urine will be decreased, okay. And it can lead to dehydration, okay, in the body. And the sign and symptoms of dehydration can be decreased skin turgor, dry mucous membranes, and obviously if the body is secreting the too much of urine, it can lead to hypotension, decreased blood pressure, and the level of sodium inside the body can rise, okay, because sodium and water, they go opposite to each other, okay. If the body is secreting too much of water, the level of sodium inside the body, it increases, that causes hypernatremia, okay. So now let's move on to SIADH. In SIADH, because there is water intoxication, the body is retaining too much of water, it can lead to fluid overload, okay. Or in other words, you can say there is hypervolemia in the body. So obviously if there is too much of water inside the body, the level of sodium goes down, okay. Exactly opposite to diabetes insipidus, hyponatremia, okay. And body is retaining the water, it is not secreting the water from the kidneys, so there will be decreased urinary output, okay. And the specific gravity will be increased, the urine production will be concentrated urine, okay. And the urine will be concentrated, it will not be diluted, okay. And specific gravity will be increased. And in fluid overload, there will be edema, okay, edema all over the body. Plus, because of fluid overload, it can lead to weight gain, because the body is retaining water. And if there is too much of water, it can lead to some overload on the cardiac system also, that can lead to increased heart rate, okay, and hypertension, okay. And if the balance of sodium and water goes imbalanced in the body, it can lead to confusion, okay. and cerebral edema. Okay, too much of fluid overload can lead to cerebral edema. Plus, these conditions can lead to seizures. Okay, because very severe hyponatremia can also lead to confusion and seizures. Plus, there will be anorexia. Why anorexia? Because the body is already retaining too much of water, so the body will not be craving for any food. Okay, the body will be feeling full, so anorexia will be there. Okay, so these are totally opposite to each other. Okay, and in the next video we are going to discuss about the management of both diseases, that is diabetes insipidus and SIADH. Okay, so till then, take care. Thank you.